Joining me first on that is Ashley Lopez, senior reporter covering healthcare and politics at public radio station KUT Austin.
How long can an abortion provider go without providing abortions? It's like anything, any sort of organization that's 85% of their work is taken off the table. How do they survive? And let's say clinics can find themselves in a situation where they can't keep their doors open because most of their, patients can't come in.
Well, let me bring Jody Hicks into the conversation now. Jody Hicks is president and CEO of Planned Parenthood Affiliates of California. Jody, thanks so much for joining us. Julie writes, I understand why some people are opposed to abortion, but it seems to me that anti-abortion activists do not know or care why people have abortions. If we as a society address the needs that abortion fills, we will naturally reduce the number of abortions in a non-coercive manner. Jody Hicks, your reaction to what Julie writes, and also if you want to say a little bit more about not necessarily just the conditions that create a need for abortions, but also what you touched on earlier, which is the incredible burden of trying to access one.
Sure. I mean, I think, that's exactly right. We know the data speaks for itself that the more access you have to healthcare, the less people need to have emergency type healthcare services. But I think what's important for us, the crisis for abortion rights is having a real moment. It's not something that we should talk about as if somebody should have to have barriers or it shouldn't be an easy decision.
Let me go to Kristin in San Francisco. Hi, Kristin.
Hi, how are you?
Great. What's on your mind?
I just wanted to talk a little bit to your points about why people get abortions. I am the executive director of Pro-Life San Francisco and the founder and president of Take Feminism Back. And if you look at the reason that people get abortions, 73% according to the Guttmacher Institute get them because they are low income and can't afford to raise a child. Well, the organizations that I run actually do fundraisers and help people financially support their futures and fight for laws that will implement policies that help people who are low income. And if you actually look at the polling over the past many years, people who earn less than $40,000 a year are actually more likely to oppose abortion. The majority of them oppose it. And I think that the points that, pro-lifers don't care about people who are low income is just disingenuous, because if you look at the way the abortion industry is constructed, its entire business model is a Band-Aid solution to the society that we've created that lets capital matter more than human beings. And I think that what we need to be telling people is that low-income people matter, their unborn children matter, and that the abortion industrial complex is using this Band-Aid solution of abortion to cover up the ails of a capitalistic society instead of helping people who are low income.
Let me give Jody Hicks a chance to respond. Kristin, thanks.
Sure. I mean, abortion services are obviously a small percentage of the overall health care that is provided by most clinics.
Any sort of organization that's 85% of their work is taken off the table, how do they survive?